For our 9th tank talk session, we're going to go over some case studies on fish health that will cover some of the topics that we've already talked about, primarily the different diseases we've seen in fish. We'll start out with some case reports on tropical fish and then some koi. And in this particular one, we have a fin of a fish. I believe this was an angelfish. We're looking at the head of the fish is to the right. This is right at the operculum of the fish, so this is a pectoral fin. And there's these little black spots on the fin. And you might think that maybe this is some melanophores, which are the black pigment cells of fish, but these are actually an encysted trematode worm. So it's a flatworm. A Digenean flatworm means that it has multiple generations, multiple hosts for its development. And it's encysted in the fin. If we take some of those samples off there and look at it under the microscope, this is what you'd see. So each one of these is a fluke or a trematode, and it's waiting in the fish for the fish to be eaten by a bird or a mammal. So different species of trematodes have different life cycles that involve the different hosts. And in the typical in the fish one, a waiting bird will pass feces in the water that contains eggs from the trematode. The eggs hatch into miracidium, which will enter into a snail. Now, different species of trematodes might go into anything from mosquito larvae to tubifex worms to other types of organisms that are found in the water, cyclops or other crustacea or snails in this particular case. Inside the snail, it develops into a cercaria, which then leaves the snail and swims through the water to find a fish. It burrows into the fish. It can get into the skin, the fins, some get into the eyes, some go inside, can be found on the gills or in internal organs. At that point, it will form a cyst where it stays, and it doesn't really develop further at that point until either a bird or a mammal, again depending on the species, eats the fish, and as it's digested, these metacercaria are released into the digestive tract of the definitive host, and there they will develop, they'll reproduce and pass eggs out of the feces of the host, so the bird droppings into the water, and the cycle starts all over again. So these are commonly seen in aquarium fish. They usually don't cause much harm if it's only in low numbers, but if there's high numbers of them, they can cause organ damage or disfigurement of the skin and fins, and they can be treated with praziquantel. Another case is involving guppies, and guppies are one of the best-selling aquarium fish. They also are very delicate initially because of the transportation with those long, heavy fins. And we do see guppies that have a significantly high loss in some cases. And so since it's a popular selling fish, but does seem to have more health issues than some of the other fish, it's important that we figure out what's causing these problems and fix them so that we can reduce the losses of the guppies in the pet industry. So this was a test I ran to help determine what was causing the losses of guppies. So the test protocol involved using two separate sets of aquariums with identical fish in each set. Each set of aquariums had its own filtration system on the bottom to maintain proper water quality. So the guppies were divided among these two systems so that I could test some with treatments and use the other as a control without treatment. So each of the guppies groups was given physical exams to determine what kind of problems they had, and they were inspected microscopically for internal and external parasites. And the water quality in both systems was maintained, because we've talked about, of course, in the water quality program, but there's no treatment that will be successful if the water quality is not also maintained. And so here's a sample of a yellow guppy. It's having a biopsy from its tail, and it's put onto a drop of water on a microscope slide covered with a cover slip, looked at under the microscope. And in this image, you can actually see on the tail fin, the little yellow and black dots are the color pigment cells, so melanophores and xanthophores, yellow and the black pigment cells. But in the middle of this photograph, there's also a parasite, and this is actually a monogenean trematode, so another type of flatworm. And the monogenean trematodes live all their life on one host, so they don't need multiple hosts to reproduce. So this skin fluke will live on the skin. It attaches with hooks, which cause a lot of damage to the surface of the fish, and then it will reproduce, and the babies will attach and live on the same fish. Other monogenean trematodes, like the gill flukes, lay eggs. Those eggs can come off the fish, hatch, and then the babies will swim back to find another fish. So on one of these, we've already found parasite, the monogenean trematode. You can also take fecal samples. So here's a guppy in a little plastic container where it was being held during its biopsies, and it passed some stool, so that was sucked out with a syringe, put on a microscope slide, and examined microscopically. And with that, we can diagnose sometimes some intestinal parasites like the spironucleus, which is a flagellated protozoa, or maybe different types of worms like Camellinus and Capillaria, or even tapeworms. And any fish that died in this study were completely necropsied, so we could look at the intestinal organs, the internal organs, the intestines, kidneys, livers, gills, any other thing looking for parasites. So after examining all these fish, we found a variety of different parasites on them, and it was actually surprising to see how many different parasites were on some of these fish. So, for example, this laser beam guppy had Gyrodactylus, which is a monogenean trematode. It had Chilodonella, which is a ciliated protozoa, and Spironucleus, which is a flagellated protozoa that's found in the intestinal tract. And you can see a lot of these were commonly found in many different species. The interesting thing is when you look at the losses during the study, some of the fish that had higher loads of parasites also had higher loss, whereas one of the guppies, I did not find any parasites on it, so it had no parasites, and it had 0% loss. Whereas the tequila sunrise guppy with Gyrodactylus, Chilodonella, Pentostomids, Tetrahymena, and Costia, so a variety of different worms and protozoa, and it had 80% loss. So this does show that the amount of parasites can be significant in causing loss of the fish. So what we need to do is figure out how to get rid of the parasites. So I treated the fish with different treatments because different parasites require different treatments. So I used the Parasite Clear tablets from Jungle, which help with the protozoa infections, and then also I used Minfin, which helps with the fluke infestations, and the control system was not treated. And treating the variety of parasites found on the guppies required several different medications and modes of administration. And so we already mentioned what we were using there. And also we used formalin solution, which is commonly seen in over-the-counter ick medicines, contain formalin and methylene blue or malachite green or similar compounds. So the Minfin, one of the advantages of using it is it has a neutralizer called Nufin that after you put the Minfin in for a certain period of time, you then add the Nufin, which neutralizes the Minfin, and it breaks it down so there's no residual medication in the water once you neutralize it. For the intestinal protozoas, we treated with a medicated food that contained metronidazole and fenbendazole. So the metronidazole is good for the flagellated protozoa. The fenbendazole is good for the worms. And the skin flukes were treated with the Minfin, and they can also be treated with Parasite Clear tablets or tetraparasite guards, which contain praziquantel. Praziquantel is the treatment used for flukes, both monogenean and digenean flukes. We'd already mentioned that the ones that had the most parasites had the highest loss, and the ones that had the least parasites had the lowest loss. But there was loss in all of the different guppies that did have different parasites on them. And the external parasites that we did see often lead to bacterial infections that you don't see. And those bacterial infections often are what actually kills the fish. But this study did show that the parasitism influences the health of the fish and increases their loss. So the guppy loss was steady throughout the test at about 2% per week that had no treatment. However, once we treated not the control group, but the test group, the losses pretty much stopped for 3 weeks, and then on the 4th week after treatment, only one more guppy had died. And so had we started treatments earlier, we would have had significant less loss in that group as well. So on this chart, you can see the blue line indicates the initial examination phase for both groups of fish were about the same, and the loss was fairly steady. Once we started treating on week 3, the loss almost completely stopped in the treated group, but the loss continued at about the same rate for the control group. And so if you had guppies in, let's say, a fish store that came in and you weren't treating them for the parasites, you would have just a steady rate of loss in those guppies. Whereas once they were treated, we could reduce the loss significantly. So the benefit of treatment is to reduce the loss in the fish, which has a significant cost when you're buying fish to sell, but then those fish die rather than being sold. And the guppies improved dramatically once we started treating the fish. So in all the treated fish, the guppy loss decreased by 47 to 52% depending on color variety, compared to the same color variety in the control group at the end of 8 weeks of testing. Our next case involves Ova retention in koi. So this is sometimes seen in older female koi. They get this big fat belly and they don't release their eggs. So it can be called egg binding. And in the normal reproductive cycle of koi, the water temperature will be cold in the winter, it'll warm up in the spring, and as that water warms, it stimulates the fish to reproduce. Because in many cases we're keeping koi in warmer water, or we don't have the natural fluctuation of cold water to warm water in the spring, there may not be that stimulus for them to release the eggs. And if those eggs aren't released, they can develop into just a big mass of eggs. It causes abdominal organ damage, kidney dysfunction, and osmotic regulation abnormalities. And they can also gradually over time become gonadal sarcomas, which is a type of tumor. As the water temperature warms and the daylight lengthens in the springtime, the natural cycle of carp would be to start spawning when the temperature gets above 63 degrees. Koi are a domestic color variety of a carp, a combination of the Amur carp, and then some of them have been crossbred with the common carp. If the koi are kept indoors or in a heated pond, they don't get that stimulation to reproduce in the spring, and they can maintain these eggs and not spawn them. The other factor is that we often have our koi overfed, and in a natural environment, if the koi didn't spawn its eggs, because they'll often go through a period of fasting or less food available, the female koi can actually reabsorb those eggs and break them down. But in a koi pond, we often have very fat fish. We overfeed them in many cases, and there's never this lack of energy that the fish gets that would cause it to reabsorb its eggs, and so it continues to hold those eggs. So in this particular koi, it has a very fat belly, and it's been a while. The owner had seen this fat belly for a while, and it gradually was appearing to start being not doing as well, sitting on the bottom. Sometimes you'll see these just on the bottom of the pond. They might even have red lesions on the belly from bouncing along the bottom of the pond rather than swimming normally. So the best way to diagnose whether this is an egg mass or a tumor or a gas bladder problem or other things is using x-rays or ultrasound. And these will be very helpful to look inside the fish and see what's causing that abdominal swelling. differential diagnoses. So other things that could be causing this would be just a fat koi. Sometimes koi that have crooked spines because of a possible injury appear to have a swollen belly, but it's because their body is shifted to one side over the other. It could also just be pregnant, be gravid, ready to spawn, but hasn't yet spawned. It could have egg binding where the eggs have been retained and haven't passed. Dropsy is a name for ascites or edema where fluid is retained, and that can be caused by kidney disease. So instead of seeing this belly full of eggs, you might see a belly full of fluid. Abdominal tumors can occur from different organs, the liver, the kidney, but often with the gonads, so gonadal sarcomas. And I've seen cases where it looked like the abdomen was swollen and we thought it was a egg binding case, but it turned out to be an abnormally large gas bladder. So there are some other things that can cause abdominal swelling, and it's helpful to get x-rays to determine what it is. This is a CAT scan of a female koi, and you can see in the picture down on the bottom this little spotty area here. This is a giant egg mass. Above it is the gas bladder. There's 2 chambers to the gas bladder. But on this fish, you can see how distended its abdomen is. So it's got a big belly and it's full of eggs. Now this does not appear to be a tumor. This does appear to be normal eggs. So in this particular case, it might be able to be treated by environmental manipulation, cooling the water, then warming it up, decreasing the daylight and increasing the daylight, both of which will help induce spawning, and also maybe some treatments of hormones to cause it to release those eggs. Now, this image was taken by Greg Lubart from the North Carolina State University, and it's a wonderful CAT scan of a female koi full of eggs. So here's a specific case of a very large white koi that has this red, and the red is not red pigment. This red is swelling, it's bleeding. It's caused from tissue damage because of the swollen abdomen. So the fish was pretty badly damaged on the skin from the swelling, and the owner elected to have it euthanized. And so we euthanized the fish, and then you can see on this image the red bubbles on it. Those are all just tissue distension from the skin, probably from fluid accumulation due to lack of kidney function. So on the necropsy, we first saw this huge egg mass. So the tan matter here is one side. This would be the right side of the egg mass. There's another ovary on the other side of the fish that has the same volume of eggs in it, very, very thick. This is like several inches thick. And the interesting thing about this is between the 2 egg masses, the abdominal contents, so the liver, the pancreas, the spleen, the intestines, were all essentially smashed, very, very thin, like if you were pressing your hand on both sides of everything in the abdomen and just smashing it. And you can even see the red down here, which is hemorrhaging. So there was significant internal damage to this fish. And at this point, even with surgery to remove those egg masses, it might have been that this fish would have died because of previous damage to the internal organs. It just wasn't something that it would recover from. On this slide, this is a younger, smaller koi, but showing, sort of a normal amount of eggs that would be found in this. So this is just one side of the egg mass. You see the anterior and the posterior chambers of the gas bladder. The eggs are underneath it, and the internal organs are between the 2 egg masses, but the egg masses are not so enlarged to cause compression of the organs. Here is a similar koi, very large female koi, very swollen abdomen. You can see its back even appears to be arched because of the swelling of the abdomen. And on necropsy on this particular fish, the egg mass, which is all of the red and tan portion, is egg, but the tan portion is normal color and the red portion is all just bleeding. It had hemorrhaging inside of this egg mass, and so it was had internal bleeding, and that was really the cause of death on this particular fish from the swollen mass of eggs. So when you start seeing these fish with really big bellies and they've gone through this spawning season but haven't laid the eggs, they haven't spawned, there's a variety of things you can do. We already talked about environmental manipulation, which may help to stimulate them to spawn. And then there are various different hormonal stimulants that can be given. So things like carp pituitary extract, human chorionic gonadotropin, and there's a drug out called Ova by Sindel, and this is probably your best option. It works very, very well. You give the fish an injection intramuscularly or intracelomically, and usually within 12 hours, 9 to 12 hours, they'll start releasing those eggs. So that's been very helpful, very successful in cases where you want to try to stimulate the females to lay their eggs. And it's also possible to surgically remove them. So if they didn't lay the eggs after giving an Ova injection, they could certainly go into surgery if they weren't so badly damaged previously, like that one with all the blood coming out on its abdomen. That one is not a good surgical candidate. But if the fish otherwise looked fairly healthy, they can have surgery to remove those egg masses. So a couple things that I've seen in various pieces of literature and from my experience is that egg binding tends to occur in overfed fat koi. Why is that? Because they're so well nutritioned that there's no metabolic need to reabsorb those eggs that haven't been laid. And so if you put that fish on a diet, essentially, it may have the possibility of reabsorbing the eggs. So don't feed it so much. And then the environmental conditions, if they didn't go through that normal spawning cycle to stimulate them to spawn, they, like if for example, koi that are in an indoor pond, that the temperature never gets cold and then warms up. So there might be some environmental manipulations that you can do to stimulate the spawning, giving them the cool water period in spring, then gradually increasing the temperature and increasing the light can often stimulate them to spawn. And I've seen both in male and female kois gonadal sarcoma tumors. So is that related to egg binding? Possibly, but it might be just an age-related thing as well. But sometimes if you are doing an x-ray or an ultrasound and you see that this is actually a solid mass, a tumor, not eggs, then it might be indicated to go in and do surgery to remove that tumor inside the koi. So going in for surgery, it can be done. And even though the fish will survive for months with this obvious abdominal distension, it will cause damage to the organs. And so the sooner surgery is done after maybe trying the environmental manipulation or Ova injection, then your next step would be going to surgery. The surgery is done keeping the fish on a wet towel so it stays wet. A water pump that pumps water in its mouth so it comes out its gills so it can continue to breathe while it's under anesthesia. The anesthesia is tricaine methane sulfonate, which is MS-222, is added to the water initially at 100 milligrams per liter. Then you gradually dilute it down to 50 milligrams per liter, monitor the fish, and then you can adjust the anesthesia as necessary to keep it asleep during surgery. And so this particular fish is one I did surgery on. It had a gonadal sarcoma. You can see the swelling around the belly. This was only about an 18-inch long fish, so it wasn't as big as those other monster fish that were 3 feet long. And yet this one still had retained egg mass, or it turned into a gonadal sarcoma. So I'm assuming it maybe started as a retained egg mass. So here's going in and doing the surgery itself. The fish is kept on its back on a wet towel. The water is pumped in through its mouth, out through its gills. You need to keep the surface of the fish wet, make a ventral abdominal incision, bluntly dissect. There often are adhesions where the intestines or the liver might have some stickiness to the sides of the body wall. So you just gently break those down, find the mass, find the blood vessels, ligate them. I use hemoclips, which are stainless steel clips that ligate blood vessels. It's a lot easier to reach than trying to use suture material, which is way down on the bottom of the fish, and it's hard to reach down there. But with the hemoclips, you can reach down and ligate blood vessels and then remove the mass. when you're making an abdominal incision, I tend to cut through the scales and then only remove the scales that are significantly damaged, rather than taking all the scales out and then making the incision. That way I can retain as many scales as possible on the surface of the fish, and then they're sutured with either continuous suture, forward interlocking suture, or even cruciate sutures to close the skin. During the anesthesia, the fish is monitored. So here we can see there's an electrocardiogram set up. The hypodermic needles are stuck into the muscles at the base of the pectoral fins. The heart is right in between them there. And when you put on your 2 lead clamps onto the metal of the needle, you can actually get a reading of the EKG. So in this particular one, its heart rate was 17 beats per minute. It's really important to monitor the heart rate, and if it starts dropping, decrease your anesthesia. The heart can beat for a long time, even if the fish is neurologically dead, because if you cut that heart out and set it on the table, it will continue to beat. So you can't rely on just the heartbeat as signs of life. You have to monitor the heart rate, and if it starts dropping, use that as a warning to decrease the anesthetic a little bit and allow that heart rate to go back up. You can also use pulse oximeters on the fins. Those will measure the blood gas saturation, and if you start seeing that dropping, you want to ensure that you're getting good aeration on the anesthetic solution that's being pumped into the koi's mouth and out the gills. I use air stone with aeration, and I've even used pure oxygen with an air stone and bubbled oxygen into the water to increase the oxygen content to make sure the fish oxygen level stays saturated. And this is the tumor that was actually removed from that particular fish. You see it's about 3 inches long, and the fish is 18 inches long, and this tumor is 3 inches long. So it was a pretty decent size inside that fish. And here's closing up the incision, in this particular case using simple interrupted or cruciate sutures. You just want apposition of the skin, and make sure that your sutures are close enough that there's no gap. Right before the incision is closed, I like to use saline, sterile saline solution, fill the abdomen with that so that any gas that's in there gets forced up, and then as you continue to close your suture, some of that saline will leak out to make sure that you're not trapping gas in the coelomic cavity, which could cause buoyancy abnormalities. And the skin sutures will stay in for 2 to 3 weeks. They usually will cause a lot of redness and inflammation on the skin, but once you take those sutures out, that inflammation will go away. And also treat the fish with antibiotic injections. And here's this fish after surgery. Unfortunately, I didn't have available the tumor surgery before the tumor surgery, but right in this back area here was where the tumor was, and the two light stripes are the metal hemoclips that were used to ligate blood vessels. And this fish was then able to swim normally afterwards, and tumor was removed. Okay, here's a case of sudden death. What happened in this was the pond owner decided to take the rocks off the bottom of the pond. And you know, rocks on the koi pond will help trap debris and organic matter. They get pretty nasty and pretty mucky, and you have to clean them out using a vacuum system, something that will clean this debris out periodically. And the owner was tired of trying to clean these rocks, and so they decided just to take them out. And certainly with koi, which are pretty messy fish, and they also require a deeper pond than just goldfish or just an ornamental water garden, it's really better not to have rocks on the bottom so you can keep the bottom of the pond clean. So during the cleaning of the pond and removing the rocks, the water became very dirty and very stinky. That rotten egg odor. So they got the rocks out. They thought everything was fine. The water would clear up with the filtration. But the next morning they went out and all the fish had died. And so here's the fish that just, they looked okay. They didn't look like anything bad had happened to them. And yet they had all all died overnight. And so they appeared to be in good body condition with no external lesions, but the gills and the blood vessels in the fins were congested and darker than normal. And on necropsy, opening up these fish, you can see this tissue is a lot redder. It shouldn't be this red color, the dark red here up on the top. All of this redness is not a normal color looking at the fish. It's also congested and bleeding. And when you look at the tail fin, you can see all the red blood vessels in there. So there's a bleeding disorder going on here, something that was affecting the fish's blood circulation. And so the diagnosis and the key here was that rotten egg smell. It's hydrogen sulfide toxicity. So under anaerobic conditions, heterotrophic bacteria in the pond sediment will reduce sulfates in decaying organic matter to produce hydrogen sulfide gas. That hydrogen sulfide gas is usually trapped in the debris on the rocks on the bottom of the pond, and it doesn't bother the fish because it's not being released. As soon as you start digging around in that bottom, you will see gas bubbles coming up. Those gas bubbles were that trapped hydrogen sulfide, and the hydrogen sulfide will come out of that debris that's on the bottom. It'll be dissolved in the water, and then the fish will absorb the hydrogen sulfide through their gills, which inactivates the enzyme cytochrome oxidase. And of course, then that affects their oxygen carrying capacity of the blood. So preventing this from happening, you want to, if you have gravel in your filter or in your pond, you need to make sure it gets stirred periodically, rinsed periodically to keep anaerobic bacteria from growing that would produce hydrogen sulfide gas. Make sure everything has really good water flow so it stays oxygenated with aerobic activity, not anaerobic activity. And if you do notice this rotten egg odor, you need to make sure you do water changes to dilute the hydrogen sulfide that's dissolved in the water before it will affect your fish. You can also add potassium permanganate to the water at 2 to 6 milligrams per liter, which will reduce the hydrogen peroxide and prevent it from becoming toxic to the fish. One more case to cover is a case of sporadic loss. So here's a client had a 1,500-gallon backyard pond, had a sand filter with a waterfall, 2 streams that ran down in the pond. It was a very nice looking pond, looked really good, but the fish had gradually been dying, not all at once like with the hydrogen sulfide. They all died overnight. These were, one died here, one died there. They didn't look too bad. And the water tests revealed temperature of 78 degrees. Well, that's okay. pH 8.4, that's okay. Total ammonia 0.5. Now, total ammonia, you really want that to be 0, and 0.5 sounds like it's low, and a lot of test kits will tell you, oh, well, 0.25 or 0.5 is, safe or stress, but not harmful. But you have to realize that ammonia toxicity increases with temperature and pH. So here we have a fairly high temperature at 78 degrees Fahrenheit, 25 Celsius, and a very high pH, 8.4. So when you add this high temperature and high pH, you do get a more toxic level of ammonia than you would if this was at 72 degrees and a pH of 6.5, in which case the ammonia would be totally untoxic. There would be no real toxic ammonia at that level of pH because it's all converted to ammonium. And so in this particular case, at that temperature and pH, 12% of the total ammonia would be as the unionized ammonia rather than ammonium, which would equal 0.0625. And what we know is anything over 0.02 is toxic. So we really don't want any level of ammonia in the fish water. The oxygen was 8 milligrams per liter, which is at saturation for that temperature, so that was good. Total hardness, 410 milligrams per liter, is pretty high, and what that tells me is that water is evaporating, but the minerals don't evaporate, so they stay in the water. And then the pond owner is adding water to it, which is helping to dilute it a little bit, but not much. the pond owner is not removing water to do a water change, but rather just topping off the pond. And you need to actually remove water so that these minerals, the calcium carbonate, are removed with the water. So then when you add new water to it, it doesn't get too high of a hardness or mineral content. And no chlorine was detected, so that's good, that's safe. We don't want tap water in the pond that doesn't get treated to remove the chlorine. So I ran some diagnostic tests on the fish and ran fin, gill, and skin biopsies, and we found Trichodina protozoa, which is a ciliated protozoa, and skin flukes, which are gyrodactylus. And you can tell this is a skin fluke because it has the hooks on one end here, but in the middle is a baby fluke inside of the parent fluke, and you can see the little hooks on the end there internally. And so this has a fluke that's ready to have a live baby. And fin biopsies showed Ichthyopterius, Ichthyobodo, also called Costia, Trichodina, and more Gyrodactylus. So we got a lot of different microorganisms on here. And the gill biopsies found more Ichthyobodo and Trichodina and gill flukes. So we not only had skin flukes, but we had gill flukes. Gill flukes are egg layers. They're not live bearers, so they don't have the larva on the inside of them. So our diagnosis was a heavy parasite burden plus high ammonia and the gill hyperplasia and hypoxia. So all of these gill parasites will cause gill damage. The ammonia will cause gill damage. So what's happening is these fish are having a hard time breathing because of damage to the gills. Also, secondary bacterial infections can occur because of the skin damage from all of these parasites. So what we need to do is we need to improve the water quality. You can't get the fish better if you don't improve the water quality. So water changes to dilute out the hardness, to get rid of the ammonia. You can use ammonia binders, which will bind that ammonia so it's not toxic anymore. It doesn't remove it, it just makes it into a non-toxic form. So adding ammonia binders and water changes would be very helpful in this case. So correct the water quality, and then using formalin, so 1 ounce per 300 gallons of formalin to treat the protozoa, and praziquantel 10 milligrams per liter to treat the flukes, and that's going to take care of all of those parasites. So improving the water quality, eliminating the parasites, and this will get rid of all of those parasites and help those fish survive. And this case shows what happens if you don't quarantine fish. So these fish were bought from multiple suppliers. Different suppliers' fish had different parasites. They all come together in the pond and spread the parasites amongst themselves, and you get this whole variety of parasites. So you want to improve the water quality, treat the fish, and then always, we talked about previously, quarantine new fish before you put them into your pond. So after we made all those fixes, the losses stopped and the fish were healthy, and the pond owner was very happy.